Today, we highlight the latest innovations in the fight against cancer, from the importance of early detection to the array of treatments that can stop the disease, ensuring a normal lifespan for patients. We visited the cancer specialists at the Robert and Beverly Lewis Family Cancer Care Center at Pomona Valley Hospital Medical Center to find out the latest treatments and what you can do to prevent this disease. First up, what you need to know if you are diagnosed with prostate cancer.
There are many treatments for prostate cancer, and they're all tailored to you.
Next, breast cancer is now a very treatable condition when caught early.
The reason we have so many new innovations and treatments for breast cancer is because women are fighting every day for cure.
Then, if you've ever smoked, you are at higher risk for lung cancer. Get screened now.
Lung cancer is preventable, but unfortunately, if you get it, there is hope and there are things you can do.
Later, a cancer that can be prevented with a regular screening.
A colonoscopy can save your life.
And the newest tools for treatment are precisely targeting the cancer, making recovery easier.
Innovation in radiation therapy is saving cancer patients' lives.
This week on Innovations in Medicine. Other than skin cancer, prostate cancer is the most common cancer in American men. This cancer is common, but not necessarily life-threatening. In fact, there are almost 3 million prostate cancer survivors in the United States today. Dr. Sri Gorty is a radiation oncology specialist at the Robert and Beverly Lewis Family Cancer Care Center, located on the campus of Pomona Valley Hospital Medical Center. He discusses the prostate and prostate cancer.
The prostate is a small walnut-shaped gland that produces fluid that helps the sperm survive. The cancer comes from the actual glands that produce the fluid. There's a mutation in one of the cells, and that cell starts to divide more rapidly than any other cell in the local area, and it starts to take over.
Dr. Gorty discusses how prostate cancer is diagnosed.
Usually when we find it, patients come in because they had a bad blood test or high blood test, or we felt something on the prostate. The PSA test is the way that most people find out that they have prostate cancer. The actual diagnosis comes when we take a piece of the tissue, we look at it under the microscope, and we say, well, this is prostate cancer. Most of my patients, most of the ones I see, usually come in with very minimal to no symptoms. Because part of that is because as we get older, these are the symptoms that men experience anyways. Waking up in the middle of the night more frequently, going more frequently during the day, urgency, weak stream. Yes, those are symptoms of prostate cancer, but those are also symptoms of old age.
The options for treatment range from just monitoring a slow-growing cancer to surgery.
The treatment options for prostate cancer vary all the way from active surveillance to surgery to radiation treatments and different forms of radiation treatments. Some cancers of the prostate are not aggressive, and those are the patients that I would recommend active surveillance to. Typically, I tell a patient, you know what, these are your options. Whichever option you take is probably going to be the right option for you. And we don't look backwards after we've made that option or that decision. Options such as surgery. The surgeon would take the patient to the operating room and using robotic surgery, cut out the prostate. The advantage of doing that is the side effects are less. You have less operating room time. You have less hospital stay time. You have less blood loss. So there's a big advantage to some of the current surgical techniques. We do things like external beam radiation, where we use intensity modulated radiation therapy with image guidance, and we give the treatments to sterilize the prostate. We also do brachytherapy, and what brachytherapy is the placement of seeds or needles through the prostate to give radiation from the inside instead of from the outside. We also do up-and-coming therapy, such as stereotactic body radiotherapy, where instead of the standard protracted course, we're giving it over all of the radiation over 5 treatments. And that's just the curative options. Now, when we get into when patients have metastatic disease means it's spread to the bones. Even when it spreads to the bones, you can still live a very long period of time. It doesn't mean that your time is limited. I have patients personally that have 10, 15 years that I've been treating them on and off with metastatic disease. When my patient does better, when my patient beats the odds, when my patient is there 10, 15 years later, it makes us feel good. It makes me and my team feel good because we made an impact in their lives.
Coming up, the successes of early breast cancer detection and treatment. If you don't have any symptoms, you don't need screening for prostate cancer. True or false? The answer when we return. You're watching Innovations in Medicine, the show that brings you the latest information on prevention, diagnosis, treatment, and research from doctors throughout the United States. Watch Innovations in Medicine each week on this public television station. If you don't have any symptoms, you don't need screening for prostate cancer. True or false? The answer is false. Prostate cancer is one of the most asymptomatic cancers in oncology, so symptoms may or may not be present. If you have symptoms such as urinary or sexual problems or pain in the region, consult your doctor to get checked out. Every day there are success stories in the fight against breast cancer. The key is early detection. Dr. Swarna Chanduri is an oncology specialist at the Robert and Beverly Lewis Family Cancer Care Center. She reveals that this disease is quite variable for each woman, so the treatment is tailored for each patient.
Majority of the breast cancer patients are after 50, like a postmenopausal patients. But it won't spare anybody. I have seen a patient at age 22 with a breast cancer, and for age 94 was the latest one. Breast cancer is a very complex disease, and it's not the same in everybody. It's each patient who presents with breast cancer is entirely different. Presently, I think we know that some of them, they inherit a gene from one of the genes from their parents, and that may be the reason for them to develop breast cancer. And the others, the cancer is because there is a mutation in the breast tumor cells.
Symptoms may appear when the cancer is advanced past the early stage.
The symptoms of breast cancer, basically, they may feel a lump in their breast. And by the time they feel a lump, it may be already 2 centimeter mass. So the majority of the breast cancers that we pick up these days is by screening mechanisms, by mammograms and ultrasound. And the mammograms and ultrasounds can pick up less than 1 centimeter or a very tiny breast cancer abnormality, and we can cure them by just a surgical method only.
Treatment depends on the extent of the cancer.
The breast cancer treatments are variable, but first of all, surgery is involved in removing what the naked eye can see. And then the surgeons make sure that the margins are clear, and we also test, has it traveled from the breast to the other areas, mostly the lymph nodes. In the past, we used to give chemotherapy for every patient if they had lymph nodes positive. But we have come a long way. There are now certain types of breast cancers that we don't offer any chemotherapy, because if their cancer cells are multiplying because of a endocrine directed cancer, then we can put them on a different path of therapy, only endocrine therapy, and those are oral medications and entirely a different one. But if they have a targeted other kind of mutation that is causing their cancer cells to multiply, then we have other targeted therapies that will kill selectively only those cells and not destroying other normal cells.
Dr. Chanduri emphasizes prevention for the best outcome.
The prevention basically is early screening, and then taking the tumor out or when it is still benign. So I think the healthy diet, exercise, and Premarin only that as needed for 1 or 2 years after menopause for menopausal symptoms is all can prevent a lot of breast cancers.
Up next, the leading cause of cancer deaths, lung cancer. It can be prevented. A new large-scale study found that annual mammography screening beginning at age 30 may benefit women with at least one of 3 specific risk factors: dense breasts, a personal history of breast cancer, or a family history of breast cancer. While the standard recommended age for starting annual mammograms is 40 or even 45, this study indicates talking with your doctor regarding earlier screening if you have these increased risk factors. Lung cancer is by far the leading cause of cancer death among both men and women. Each year, more people in the U.S. die of lung cancer than of colon, breast, and prostate cancers combined. Hematology and oncology specialist at the Robert and Beverly Lewis Family Cancer Care Center, Dr. Preeti Chaudhry, reveals the importance of screening and the innovative treatments helping these patients live longer. First, Dr. Chaudhry reveals how this cancer is often detected.
Lung cancer can be diagnosed by routine imaging. Your primary care physician was evaluating you for something else, and a CT scan of the lungs or a chest X-ray of the lung incidentally picked up a lesion in the lungs. Or your evaluation can be based on the symptoms, and your doctor ordered a chest X-ray which demonstrated something suspicious either in the center of the chest, because we have lymph nodes in the center of the chest which can be enlarged when you develop lung cancer, or the chest X-ray showed something within the lung parenchyma. So, and as a follow-up, you get a CT scan. When you see some abnormality, then your doctor will send you for a biopsy, or they will send you to a pulmonologist, a specialist who specializes in lung disease, and they can do a bronchoscopy and get tissue from that mass through the bronchoscopy and send it for pathology evaluation.
Treatment depends on the stage of cancer discovered.
If it's early stage, like stage 1, 2, or early stage 3 cancer, then the intention of treatment is curative. You can be cured, and treatment is surgery followed by chemotherapy and sometimes radiation. Unfortunately, if you are diagnosed late stage 3 or stage 4 cancer, then the treatment is mostly palliative. The idea is to prolong your life and keep you around for as long as we can. The treatment has changed a lot for stage 4 lung cancer. It's no longer just throw chemotherapy at everyone. Now we recognize so many mutations within the cancer that we can target that everybody is offered personalized treatment. Now the big thing is immune therapy. The idea is to wake up your immune system to fight the cancer. If you are successful in doing that, then we can see some sustained responses and patients can live much longer. So the prognosis is much better than patients who receive chemotherapy alone.
Support is available to help family members through the process.
We have a comprehensive program at our cancer center to provide emotional support for the family members, because I see a lot of family members suffer more than the patient sometimes.
There is one definite risk factor for lung cancer.
Prevention of lung cancer is no smoking. Smoking is the biggest risk factor for lung cancer. And patients who have had, a long-standing history of smoking, or they were heavy smokers in the past, there is a program called low-dose CT scans. What patients are asked to do is do an annual CT scan, which is low radiation. And early cases of lung cancer are detected stage 1 and they can be cured. Other prevention is avoiding red meat. And if you have a choice between red meat and white meat, choose the white meat. So there is a lot of emphasis on eating healthy, exercising, which is at least 3 to 4 times a week, 30 minutes of walking. Those, basically adopting a healthy lifestyle.
How successful are the treatments today for lung cancer?
The success rate of treatment for patients with lung cancer depends on the stage. If it's a stage 1 or a stage 2 disease, then patients are, expected to have a good 5-year survival rate, provided they continue good follow-up with their physicians, they routinely get checked with CT scans and blood work, and don't ignore any symptoms. For late stage 3 or stage 4 cancer, the prognosis has significantly improved over the past decade. Initially most patients were not able to make it to the 1-year mark, but now we are seeing longer survivors. If it's a tumor that has a tendency to respond to immune therapy, those patients have even lived up to 4 to 5 years and still going strong.
Coming next, another cancer which can usually be prevented from ever occurring: colon cancer. Can the lung damage that leads to cancer really be repaired by quitting smoking? True or false? The answer when we return. You're watching Innovations in Medicine, the show that brings you the latest information on prevention, diagnosis, treatment, and research from doctors throughout the United States. Watch Innovations in Medicine each week on this public television station. Can the lung damage that leads to cancer really be repaired by quitting smoking? True or false? The answer is true. Even as short as 2 weeks after quitting, your circulation improves and your lung function increases. 10 years after quitting, the risk of dying from lung cancer is about half that of a person who is still smoking. Colon cancer is one cancer which is almost totally preventable. By having regular screening tests, precancerous lesions are detected and removed. Oncologist at the Robert and Beverly Lewis Family Cancer Care Center, Dr. Ala Latif, tells us about colon cancer diagnosis and treatment options.
The diagnosis is incidentally found on screening. Colonoscopy is recommended for people above 50 years old, and or it can be diagnosed based on symptoms that trigger the workup and finding the tumor inside the colon via colonoscopy, or if the tumor is spread outside the colon, inside the abdomen, it can be also seen by scanning of the abdomen. With colonoscopy, either detect the early changes that happen before the start of the cancer itself, and this is usually in the form of a polyp. It can be a very small polyp, and if it is left without removal, it can transform into a malignant polyp and then become an invasive and full-blown cancer in the future.
Dr. Latif describes the colonoscopy procedure.
The colonoscopy is done by the gastroenterologist, and the patient is semi-sedated. The camera is introduced through the anal area into the rectum and into the sigmoid and the left side of the colon, the transverse colon, and then down the right side of the colon to the cecum. And it is withdrawn slowly, and during the withdrawal, any lesion or small polyp that can be seen will be either removed or cauterized. Depends on what lesion they will be seeing with the colonoscopy.
If colon cancer is found, there are a range of treatments.
For early stage colon cancer, surgery is the mainstay of treatment, and whether the patient will be getting additional treatment after surgery or not, that will depend on the pathological stage. which means that the depth of the tumor through the colon wall or the presence of lymph nodes around the colon. And for advanced stages, or what we call metastatic disease, the disease that has spread beyond the colon, multiple treatments are available. There is chemotherapy. We can also utilize surgery at times if the tumor is in a limited area, like in the liver, and the goal can still be curative.
There are prevention strategies you can take.
Well, the best prevention is to lead a healthy lifestyle, exercise, maintaining good bowel habits, avoiding prolonged constipation. Of course, screening colonoscopy is an important part of the prevention.
Improvements in colon cancer treatments are continuing to evolve.
It is indeed amazing to see that diseases that we did not have any known treatment to improve survival, now we have multiple medications, immune therapy, biological therapy, and chemotherapy that's available to improve the outcome for those patients, both in the early stage and the metastatic disease.
Coming up next, the innovations in radiation therapy to cure cancer. You're watching Innovations in Medicine, the show that brings you the latest information on prevention, diagnosis, treatment, and research from doctors throughout the United States. Watch Innovations in Medicine each week on this public television station. Radiation therapy is a mainstay of cancer treatment, and now is targeted with greater precision so that patients have fewer side effects. Physicist Dr. Bushaib Rabbani at the Robert and Beverly Lewis Family Cancer Care Center at Pomona Valley Hospital Medical Center reveals the innovations that have dramatically improved the effectiveness of radiation treatment.
So radiation has been progressively improving over the years since the inception to today. We have now devices that we can almost treat the entire body. Like this machine that we have here is called tomotherapy, and it's going to be essentially we put the patient on the table, and the patient is treated in a helical manner. That means the patient is moving and the beam is being delivered at the same time.
Dr. Rabbani discusses his role as a physicist in radiation therapy.
The physicist's job is to work together with the radiation oncologist. For first is the machines that deliver the radiation have to be calibrated and measure the output to see that whatever dose we give into the patient is accurate and precise. So there are various ways that one has to do that. First, you have to know how the machine works, how to measure the dose, how to deliver the dose, and how to project the dose. So all of those things are the physicist's job to make sure that those are all correct. So when somebody says, I gave him so much radiation, we know exactly what that is. And the physicist is the only one can do that.
Dr. Rabbani outlines the process of determining the treatment plan.
So the first thing that the patient, once they present themselves, because they already have been diagnosed with some sort of a cancer, they come to us, they see the physician, then they see whether the disease is localized. That's one primary thing, that there are some spots that we can treat with radiation. Then once that decision is made, and also the decision is how much radiation is given, and that's the physician's role in that one, then they go to what we call simulation, where we take them to a CAT scanner, or maybe even some other device like a MRI or PET-CT, to find exactly the limit of this disease that we want to treat. Once that is done, then it goes to physics and dosimetry, and a plan is generated.
Technology has allowed the cancer care team to precisely shape the treatment at the tumor.
What we have is what's called IMRT, intensity modulated radiation therapy. It allows us to, knowing what the tumor looks in a 3D, to deliver the dose exactly where we want it and how much to each spot on the tumor. In addition to that, we now have what we call in precision therapy, which is we also know the position of the patient. One of the major things is to know where is the tumor at any given time. So we have now ways to monitor the position of the tumor in the body and to target the dose only to that area, not to treat anything that's normal around the target. A lot of changes have happened to radiation oncology, both hardware and software. It's like a day and night between what it was and what it is today with the precision that we have and the manipulation we can do. So both hardware and software have really given us a lot more to work with, and different modalities. We can treat with electrons, we can treat photons, we can do with the X-rays. There are some other ones that do proton, and there are other elements that are available now for treating patients.
Radiation treatment is more effective now than ever before.
I think radiation is playing a major role in the survival of cancer patients. It has been much better because, again, because of the beauty, one of the problems with the early radiation was the side effects. And the side effects was caused by the fact that we treated normal tissues surrounding the tumor. Now with the focus on target only, with a little bit of a margin around it to do microscopic, we are much better to give the correct dose and the amount of dose to the tumor. So there is survival is very, very good, and the side effects are minimal nowadays.
Additional support was provided by the RAND Corporation, Seacrest Industries, and the participating physicians and healthcare providers that made this program possible. Coming soon on Innovations in Medicine.
Our goal is always to reduce the impact of that disability and ideally get them back to their normal selves. So it's huge. It's amazing to see those types of recoveries.